Hey everyone, I'm Dr. Jody Thomas. I'm a licensed clinical psychologist, a specialist in pain management, medical trauma, and medical psychology, and also the executive director of the Meg Foundation. That's a nonprofit dedicated to empowering pretty much everyone around being able to manage the pain experience. So, this is a short video just to explain the tools that we offer that we want everyone to be able to have access to and use. So, we're about combining the power of medical technology and cutting edge science to bring the skills and tools that everyone needs to exactly where they need them. So, let's get started. These tools are built to empower because we believe in pain management for everyone, and we believe in putting it as quickly as we can into the hands of people who need it. So, good pain management is the difference between this and this. So, let's be real, we all agree we'd really like this one. So, how can tech help? How can these tools help? Well, the first thing we want them to be able to do is empower. We want to truly put the power in the hands of the child, the family, or the adult that needs it. And in doing that, we want to create a common language, an ability to talk about the experience by both provider and patient so we can increase their communication and their level of control. And we want to create a framework. We can't control something we don't understand. So by creating a framework of understanding pain, we increase the opportunity to manage it. And connection. We all know that the best health outcomes come from true collaboration and rapport between the provider and the patient. And these tools can give an ability to connect on the level of pain management. We want to teach skills. Information is only helpful when we can turn it into action, and that means teaching people how to do things. And maybe this is the one that becomes most important, and that is changing expectations. One of the big barriers we have to appropriate pain management is the fact that patients, parents, and providers all seem to believe at some point that at least some of the pain experience is a necessary evil, when in fact there is some opportunity for something different, something better, and something a lot more comfortable. All of our tools are built on the biopsychosocial model of pain to incorporate the entire pain experience and enhance the most chances for change and improvement. Similarly, we base all of our tools on the information, motivation, and behavioral skills model, the IMB model, first developed back in the 90s. Now, if you want any of the research on any of this, feel free to reach out to us. We also have information on the website. I'm just talking to you about the tools today. Now, the medical field tends to do pretty well with information, motivation, so, but it's the behavioral skills that really tends to fall apart. And you can see that the things that we have to offer are really about teaching people how to do things. So one of the first projects I work on was developing a video intervention for parents and kids for Stanford Children's Health. Now, this video is intended to leverage the use of language and visual metaphor in order to teach people how pain works and all the ways that they can take control and interrupt the pain experience to have more control. So I'll play it for a few minutes so you can get an idea.
You are the boss of your brain. The point of this video is to teach you about how pain works so you can learn how to have more control over your brain, your body, and your experience. Pain? What? Ugh, pain is seriously my least favorite thing to think about. Okay, fine. The first thing to know is that pain is actually created in your brain. Most people don't know that, but it's true. Your brain is the world's most amazing computer. It is constantly monitoring and making sense of all the things your body is doing and feeling. Imagine you're a caveman. You're just minding your own business when all of a sudden a dinosaur comes out of nowhere and bites you on the leg. When something harmful and dangerous happens to you, your body sends a warning signal to your brain that something is wrong, so you can do something about it. You experience this signal as pain. Pain is your body's alarm system telling your brain to pay attention. Wow. Huh. You know, I never thought of it this way before, but pain is actually really helpful. Oh, The warning signal of pain lets you know that something might be wrong with your body and helps you get out of danger as fast as possible if you need to. When a dinosaur tries to eat you, pain is very useful. But your body also sometimes gets confused and sends a pain signal to your brain when you're not in danger. Pain signals can even happen when something is actually helping your body, like when you're at the doctor getting medicine with a needle or when you have a blood test. We might not always like them, but we need these things sometimes to help us.
So you can get the idea of what we're going for. So we continue that visual metaphor, we use and explain all the interventions that are supported by the World Health Organization, the American Academy of Pediatrics, and pretty much every peds org in the world. So that includes numbing cream, vibration, distraction, breathing techniques, imagination, and cognitive behavioral techniques, and emphasizing the need for parents to stay calm and present as they're the biggest predictor of a child's distress. Now, this goes along with providing them with a game plan. So this, we know that action is the enemy of anxiety, and the more that these kids can plan to cope, the better off we are, both them and the parent and the provider. So I want to note that all of this is available in multiple languages and that the video itself is being used in hospitals across the world, and NGOs are using it for work with in refugee camps and disaster relief settings, and everyone from a clinician sitting in their own private practice office to major organizations. And this is all available for use to anyone. So the other project that I did for Stanford is the Imagine Action website. This is about self-regulation and self-hypnosis, really going over, and as you can see some of the choices in front of you, it's about the basic and most common needs that we see among kids. Now, there's also has a video explaining how it works.
Imagine action. You know, of course, that your brain is the world's most powerful computer. With just a little effort and some practice, you can learn to use your brain computer to have more control over your feelings, your body, and your experience. This control panel inside your brain regulates everything that is going on in your body. Your control panel might look like this, or it might be something else entirely. The most important thing to know is that you can use Imagine Action to run your control panel. The better you are at managing that control panel, the more control you will have over how you feel. For example, when you are in a hospital or getting medical care, there are often things happening around you that you can't really control. You might feel worried or stressed or a little uncertain. Maybe you're having some pain or discomfort that you'd really like to have go away. Or maybe you'd just really like to be somewhere else more fun. Imagine Action can help you change how you feel and be more in control, no matter where you are or what's going on around you. You can simply let any uncomfortable stuff fade away and become calm and comfortable in your body. Some people call it self-hypnosis, but we call it Imagine Action. It is part imagination because it is something you do with your powerful brain and amazing imagination, but it is also part action because it literally changes your experience in your body, and you are the one doing it.
So again, you can see that focus on the use of language, visual metaphor, and the importance of empowerment. So truly letting people know that they're the ones who can take control. So you can see all the various options scrolling by here on our demo. And then once kids choose what they, or adults, frankly, it's appropriate for pretty much any age, they can choose that. It gives them instructions on how to best utilize that and set up the situation for success. It's been incredibly successful. We've gotten really fantastic feedback on this, especially we released it right at the beginning of the pandemic when access to care was so limited. So we also have SuperMeg, which is a little interactive piece of tech that has been also really popular that interacts with kids in order to help them create a comfort coping plan, again, based on all those research-backed coping strategies. So here you can see at the beginning, we ask that we put in a parent's email address, and we do that in order to, at the end of the process, send that very customized plan based on the kid's choices to the parent, along with all the resources they would need to make that tech happen. You can see that it interacts in a very conversational way, and kids tend to do incredibly well with it. So this is an example of that email that pops up in the parent's inbox, not only explaining the basics of those pain management tools, but also downloadable content like topical anesthetic guides, comfort plans, comfort positioning guides, etc., and makes it where it's the exact choice that their kid made. So during the pandemic, we've also increased our focus to older kids and adults, knowing that 1 in 4 adults also have enough significant needle phobia to significant needle fear to change their healthcare decisions. So you can see how they have the choices, they can learn more about how it works, the steps they can take, and the actual language they can use to advocate for themselves. They can mark which techniques they want to use. And then we can go down to the Take Hacks on the Go, which gives downloadable PDF files with summaries of all the strategies, and then a downloadable game plan. Alternatively, we have another sort of a la Super Meg, a plan builder for Hack the Vax that interacts in a very similar fashion, available in English and Spanish, where they again are guided through all the different possibilities for coping strategies, make their choices, and that plan is once again customized and sent to them in their inbox. So this can be incredibly useful. And again, our emphasis is always on the action is the enemy of anxiety. And as they make their choices, we increase the likelihood that they are able to go through with their vaccination or medical procedure, and that it's going to be a much more comfortable and empowering experience. We have a similar piece of tech for nasal swabs. So knowing how many times we've had to shove very long swabs up kids' noses and adults' noses, it needs to be actually one of our most popular pieces of content. So in the next week or two, or perhaps actually by the time you all are seeing this, we're releasing another piece of interactive tech focused on parents, featuring Super Meg, and recruiting them to, as we say, wield the shield and be able to protect their child from the possibility of bad medical experiences. So this not only includes education about pain management strategies, but we also know from our research that some of the barriers to that is parents really is their wariness of being able to advocate for their child. And so we include things like speak up scripts, where it actually gives some of the language and wording we could use to ask for some of these interventions, do a pre-appointment phone call asking about pain management, et cetera, et cetera. We also have comfort talk scripts, and those are also pop-ups within the application that coach the parent in how to talk to their child about the various pain management techniques, how to talk about comfort positioning, topical anesthetics, etc. So once again, along our theme of skill building and empowerment, talking about relaxation, breathing techniques, there's breathing video guides. And then we also have links to all of our things like infographics. Also, all of these are available in multiple language, creating comfort for kids of all ages, nasal swabs, things like comfort positioning guides that can be easily downloaded, and topical anesthetic guides. Again, all of this content available in multiple languages. And then we have our expert content blogs, where we go over in more detail specific things like pain management for gender diverse youth, headaches. We'll be having some on stomach aches, a lot of needle phobia, how to have difficult conversations with kids, nasal swabs, etc. So of course, the thing we love, we're all about the science, and scientists here, so we love getting our data back. And we also really love getting to see the words of the people who have really benefited from what we're able to put out in the world. So we know that what we really want, again, is that empowerment theme. And we love feedback like this, that the Meg Foundation has helped me feel more in control as a parent rather than helpless. We get the same thing with the kids we work with. So what our goal is to be able to hand all of that to you, the amazing people doing a lot of good in the world. We are all about leveraging collaborations and partnerships, and we want to hand all those doing good in the world any tools we can to increase their reach and impact. So we'd really love for you to go to our website, www.megfoundationforpain.org, also hackthevax.org. We also have a partnering kit, which can tell you various things of the various ways in which our content can be used, and that we are always available. Please reach out if we can do anything. I also encourage you to follow us on social media on Twitter, Facebook, Instagram, and TikTok. This is where you can access also a lot of information. And that, along with our newsletter, you'd be in the know whenever we drop new content and new things for people to use. Thanks again for listening today. We're really excited to be able to connect with any all people who are interested in getting our stuff in the hands of people who need it. Thanks.